Hey guys, this is Dr. Joe Borio. Hopefully you're having a great day. Hopefully you're making it a great day. I wanted to spend a few moments with you today. We had seen a patient, a woman that had come in not too long ago and had curvature of the spine, scoliosis of the spine. So for maybe some of you, that's a word you're not familiar with. For those people maybe that have it or suffer with it, they're going to be really familiar with it. But what it means, real simple, is that your spine genetically developed crooked, or, and more commonly, as a result of traumas or injuries to the spine at an early age, including the birth process, which is a real common cause. The spine will develop crooked. There's a saying in here, it says, as the twig is bent, so grows the tree. So if you're bent crooked when you're little or a baby, often the spine will grow much more crooked as you age, as time passes. The other big challenge, like I said, is we'll see genetically. So let me show you what this is, and I want to share the story with you for a minute of a woman who came into our office here, and we just saw her recently, and talk about what's going on inside her. So when we look at your spine from the front, this is an x-ray here of a lower back from the front. So essentially you're standing like this, straight ahead, and I'm taking a picture of you inside. So you're gonna see here, the spine is relatively straight. So you're gonna see a nice, beautiful alignment through here. Pelvis is relatively good. Spaces are good. So that's what your lower back should look like from the front when I look at you, okay? So I just wanna show you now, this is a woman that comes into my office, and this is looking at you, and I'm not making this up now, just to show you what's going on here, right? Look how crooked that is. So that's a picture of her from the front. So just like I showed you here, and forgive my reach here, I'm by myself here. We're not doing high-tech video here, okay? And you're gonna see that's what it should look like, right? And then when you look at her spine, you're gonna see that's what she looks like. So remember, you'll hear me say this a lot, there's no health in crooked. So when you look at that, most people think orthopedically right away. They're gonna say, wow, your back must hurt because it's so crooked. And that's true. You are gonna have back pain. You're gonna see children, one of the most common complaints that children are gonna have is their back's gonna hurt, right? But what you're gonna see, even more importantly, and this is really where we start talking about the benefits of chiropractic care, okay? When you look at this, think of this. Now here is the spine, and think of this as like the wires to your spinal cord. So you ask yourself that question, right? If that's your spinal cord running through your spine and it's that crooked, what's happening to all these wires? And then the next question should be, where do those wires go? So if those wires are being damaged and pressed on, which they are, it's going to damage the nerves, therefore the messages that go through those wires aren't going to get there. So think about what's happening to your organs, right? So essentially health and life and healing, your body's ability to function all goes through the spine. It all goes through these critical, delicate little nerves. And when you come in and I take a picture of you like this, and then we start going through your history, as a woman, you're gonna say, wow, I have back pain with my menstrual cycle. I have digestive issues. I have abdominal cramping. Maybe you're prone to all kinds of, if you will, changes in your menstrual cycle. So you can have polymenorrhea, which means you're having a lot more menses than you're supposed to. You can have dysmenorrhea, which means they're very irregular, right? And all of a sudden, sometimes you'll be heavy in your bleed flow. Other days you won't be. You're going to have a lot of trouble with pregnancy. You're going to start to have a lot of challenges. And what that indicates to us is those nerves, those delicate nerves down here are being affected. And as a result, those body parts are getting sick. And that's clearly the story here of this young woman. So this woman comes in to see us and she says, hey, I'm coming in because my back hurts. I know I have scoliosis. It's said almost dismissively. And then when we take her x-ray, we're looking at an x-ray with a curvature well into the 30-degree curvature, and which is severe. And when we start talking to her about her overall health function, you're seeing that, wow, she's got all kinds of health problems in her body, and her body essentially is getting sick. It's breaking down. When your spine goes out of alignment, there's a very specific word that describes that misalignment, and that's called a subluxation. And that word subluxation means the spine is losing mobility or alignment, and it's affecting the nervous system in a bad way. And unfortunately, we all have it, and uncorrected, it causes a lot of problems. You can see how severe her condition is. So when you look at her overall health, you're seeing, wow, she's got all kinds of health breakdown, as well as my back doesn't feel good. So when I asked that initial question, should you see a chiropractor if you have scoliosis? The question number one is, what does a chiropractor do? We're going to straighten the spine. We're going to put pressure on the spine, allow the body to work better. And when you look at how crooked she is, if there's anybody that needs to be in his office, this is a person with scoliosis, right? Number two, the other takeaway from this is a better time to start would have been when? When would have been a better time for her to begin care? When she's in her 30s, when she's in her 20s, right? Tens, right? Her teens, or when she's pre-10, right? The ideal situation would have been when she was an infant or a baby, because often we can identify where the spine's damaged immediately and then offer adjustments very specific to the spine so that that infant or that young child doesn't grow up with severe abnormalities within the spine, or certainly minimizes it if it's genetic, minimizes those. And not to mention the overall health benefits. Just dramatic as far as immune system, digestive is going to improve, their overall function, their health, their coordination. We're showing now that when the spine's sick, it affects brain activity. So when these children are damaged and sick, alignment-wise, it affects their ability to learn, their ability to talk. So should you see a chiropractor when you have scoliosis? Absolutely. And sooner is better than later. The idea of watch and see, to me, and I don't mean to be disrespectful sometimes to other people in healthcare, but to me, I find that to be the worst position possible. Literally, that's like saying, well, you have heart disease, let's watch and see and wait till it's worse before we take any action. That's a bad position. So in here, I would certainly tell you, get care as soon as possible. So if you know you have scoliosis, get in here as soon as you possibly can. If you know somebody, certainly share this video with them, tell them what's going on, and let them learn for themselves and see for themselves why it's so important to get care. Also, if you have young children, one of the best people to see, and I don't mean to sound biased, but the best healthcare professional out there to take a look at your spine is a chiropractor, because that's all we do. We focus on the health and alignment and well-being of the spine and nervous system. So I'd certainly encourage you to get your family in to get checked. Now, I'm Dr. Joe Borio. I'm in Central New York, and I would love, it really is an honor when people come in and say, hey, take care of me. It's something I love to do, and I still love to do after almost 30 years of practice. But listen, if you're watching this video and you're not local, or you are local but you have somebody that you want under care and they're not local, reach out to me on the messages, or message me on my Facebook, or call the office. I'll be happy to find that individual that you love and care about. I'll find them a chiropractor that's just awesome, and they'll take great care of them to ensure that they get well and they are taken care of to stay well. Okay, again, this is Dr. Joe Borio, Central New York. Click the link above or below. Visit us on the web. You can visit us on our webpage. You can fill out patient information right there, download it at home, and then bring it right in. But we'd love to see you. So don't wait. Get in, get your spine checked, get your family in, get them checked. And if you do have scoliosis and you're not under care, I would encourage you strongly to give our office a call. Let's take a look at your spine, measure where it's crooked, and start giving you some care to get it not only straighter and healthier, but to get you healthier and live a longer and better life. Okay? Hey guys, I'll talk to you next week with a new case. Hopefully you're excited about this stuff.